Hi, I'm YI-CHIEH. I'm going to present our research designing the chatbot as a mediator for promoting deep self-disclosure to a real mental health professional. This work is collaborated with NTT researcher Naomi Yamashita and my advisor Huang. In this research, we are interested in the user self-disclosure behaviors with the chatbot to explore how the chatbots could encourage humans gradually disclose their personal information, thoughts, feelings, and even fears to others. Due to a time limitation, we offer the full versions on personal website. I will share a link at the end of this presentation. This figure explains the scenario of our study. There are two main parts in this study. In the first part of the study, we are interested in how to design a chatbot to elicit the user's deep self-disclosure. As I mentioned above, in the healthcare application, it may require users to interact with the assistant over a long period of time. Thus, through a long-term interaction with the chatbot, we are interested in if a human could follow build a relationship and a self-disclosure deeply with the chatbot. For the second part, we aim to develop a chatbot that plays as a mediator between users and human supporter. Thus, after collecting users' deep self-disclosure, we are wondering if a chatbot could serve as a mediator to facilitate people's self-disclosure to a mental health professional. First, we investigate how participants will share their self-disclosure with the human experts through a chatbot. And we follow experts what factors will affect users' sharing behavior. There are three conditions in these studies which controlling different level of chatbot self-disclosure. So that is from the no self-disclosure to the high self-disclosure. We want to see if the different level of the chatbot self-disclosure could elicit users' deep self-disclosure and share with the third party. The conversation flow follows most of the chatbot design for healthcare. Most of the applications usually start from greeting and then jump to the guidance or treatment, which is similar to the ND condition in our study. We modify this design by adding small talk before going to a sensitive question. And we control the chatbot self-disclosure level to explore how it will affect user self-disclosure. In the second part, the chatbot will introduce a doctor or say the mental health professionals to the participants and suggest them to share their self-disclosure with their doctor. And they are allowed to modify their prior response before sharing. This is our study result. We found that most of the response were shared. Only 8% of them not shared with the doctor, which means that chatbot can effectively mediate users' deep self-disclosure to a mental health professional. However, we found that there were some users decide to add or delete their prior answers. Those users tend to reduce all details, such as their thoughts and feelings, especially for the ND group. Users also did not like to share their thoughts, which may relate it to others, such as families or friends. However, some participants add more information before sharing with the doctor. There are two main reasons why they add the information. As you can see from the slides, the first reason is because they want to help the doctor to understand their response. And they also maybe change their thoughts when they saw those questions again. For the interview, we can see trust was one of the important factors mentioned by the participant. Thus, we present our survey result of the participants' trust in the chatbot and NHP at the different stages. Based on these figures, you can find that sharing data with doctor did not decrease users' trust in the chatbot. However, we can see that when evaluating users' trust in the doctor, HD's members has the highest level of the trust. The reason is as the quote, the high self-disclosure chatbot could be used to convince users to trust the third parties. Here, I give three insights from our study. The high self-disclosure chatbot design connected participants with their doctor, which may help lower the barriers of sharing their deep self-disclosure. However, ethical issues may be raised here. This finding also implies a potential risk for the users to overshare their private information with the chatbot. This may cause users to disclose their vulnerabilities, which may be dangerous if they are abused. Leverage the bonding between the professional image and the chatbot need to follow study. Over-edges in professional image may result in users overestimating a chatbot's efficacy. Finally, this is a limitation for this study. Although participant has a deeper self-disclosure and willing to share with the doctor, this also increased their expectation from getting feedback from the doctor, but we did not address this impact in the study. Therefore, in our future study, we are going to explore the effect of integrating users' human support in the human-chatbot interaction to give guidance, influence users' behaviors and experience. Thank you for your listening today. This is my presentation. If you want to see the full version, please reach my personal website. We provide a full version of video on my website. If you have any question, please feel free to leave your message or send an email to me. Thank you.